Welcome back to the channel. My name is Dan Zatarski. I'm the pharmacist here at MD Custom RX. In today's video, we're going to spend a few minutes learning about leaky gut syndrome, what causes it, what the symptoms are, and of course, how to fix it. So, leaky gut syndrome or intestinal permeability, a lot of those terms get kind of interchanged, is essentially what's happening is the cells in the GI tract are spreading apart, so to speak. We can think of it that way. Or they're loosening up so that instead of vitamins, minerals, macronutrients getting into our bloodstream through our stomach, now what's happening, yes, of course, those materials are getting in, but now there's endotoxin from bacteria getting in. There's larger proteins that should not be absorbed into our blood that are getting into our bloodstream. And so with leaky gut syndrome, we want to make sure that there is a protein called zonulin in place so that those junctions don't have that ability to loosen up. So let's take a little bit of a deeper dive into zonulin, what this protein is, who makes it, and why it's so important. So zonulin. Zonulin is a protein that is made actually by our intestinal cells themselves. I think of zonulin as a gatekeeper. And so again, we have one layer thick of cells that separate what's in our GI tract, in our small intestines essentially is what I'm referring to, and in our bloodstream. And so those cells have a very important job to literally keep the crap out of our blood, but also at the same time let all the nutrients, the glucose, the proteins, or I should say the amino acids rather, the fats or the monoglycerides, I'll call them triglycerides, getting into our circulation. So our body produces zonulin at a certain rate. When that rate is increased, we've got too many gatekeepers and only so many places for these proteins to go. What ends up happening is it's kind of a story of Goldilocks. If you don't have enough zonulin, that's a problem. But usually what ends up happening is in our environment we overproduce zonulin, and we'll get into those reasons in just a minute. But this overproduction of zonulin ends up causing our body to actually absorb the zonulin, and those tight junctions are no longer tight, they're now loose. And so we've got to figure out, okay, what's causing our cells to overproduce zonulin? Let's look at that right now. So the first one that I always like to look at or identify is dysbiosis. So what do I mean by that? Overgrowth of bad bacteria. How do we know if we have an overgrowth of bad bacteria? Well, an easy way to do that is do a stool analysis test. Again, ask your provider if he or she provides that particular test. There's multiple companies that offer that. Or you could certainly call the pharmacy. We provide those here as well. Dysbiosis can be a little bit tricky to resolve as well. Once we know that there is an overgrowth of, if it's bad bacteria, it could be an overgrowth of yeast or Candida, then the treatment regimen can look very different depending on what that particular bug or bugs that are overgrowing in our intestines looks like. So you want to work with a skilled, again, functional medicine doctor if you can find that, or a wellness provider that understands the microbiome of the GI tract. Enough about bugs. Let's get into one of the other common culprits for overproduction of zonulin, which causes leaky gut then, and that is gluten. Gluten, as we probably already know, is a protein that's found in basically wheat, oats, barley, and rye. And so this gluten protein, it's kind of like the name says, it's a glue material. It's a protein made out of gliadin and gliadin. Those are the two subunits of gluten. Why is gluten so bad, right? We always hear about gluten and it causes inflammation, but how does it do that? Well, it's essentially getting into our bloodstream and it's causing leaky gut. So it just cascades an inflammatory process starting in our GI tract. So how do we know if we're gluten sensitive? There's a couple ways we can do that. Again, talk to your provider. You can do a test. You can come here to the pharmacy and do a blood spot test that you take home, and you can test for it. You can see if you have a gluten sensitivity. Now, of course, your doctor can do a gluten test, and there's a more formal process for this to identify if you have what's called celiac. And I encourage you, again, if you're eating bread, if you're eating, again, rye, oats, barley, if those foods are problematic for you, talk to your provider, see if they can do a gluten sensitivity test for you. The third category that can cause leaky gut is immune-related issues. So what I mean by that is where the immune system becomes hyperactive, and so it tends to, or can react to really anything in our environment, a toxin, a food sensitivity, and that immune system all of a sudden gets triggered and it becomes hypervigilant. And that irritation, whatever that irritation may be, will then unfortunately upregulate those intestinal cells to produce more zonulin. And again, more zonulin isn't better. This protein is a gatekeeper up to a point. And when we reach over that threshold, that zonulin is going to then, instead of being the gatekeeper, is going to absorb systemically into our bloodstream, and that becomes a problem. And now, again, other toxic material, biotoxins from bacteria called LPS is a common endotoxin that shouldn't be in our blood, has this opportunity to enter into our bloodstream. And there's many more examples of materials that should not be getting into our bloodstream that can be causing issues. And some of these things are very subtle. A third thing I would encourage you to look at if you've got leaky gut is minimizing inflammation. So what I mean by that is looking at your stress, looking at your sleep. If you're overstressed, that could potentially be causing that zonulin overproduction, or if you're not getting enough sleep. So anything to help with rest and repair and minimize inflammation can have a very positive effect on your GI tract in getting that set up and repaired properly. Which brings me to my next point is, what are some of those symptoms, more common and maybe some less common symptoms that are related to leaky gut syndrome? So what happens when we have leaky gut and we have zonulin floating around in our bloodstream? What are we going to feel? How is this going to look from a patient presentation standpoint? Well, as you probably could have guessed, if we have leaky gut or gut permeability, we're going to have potentially gas, bloating, diarrhea, constipation. It can look a multitude of different ways. Other things, we can have IBS or Crohn's, something a little bit more severe. We could have celiac disease. So if you've, again, have gone through the formal testing for gluten sensitivity and have been diagnosed with celiac, that can be related to your intestinal permeability. Again, somebody with celiac should not be consuming gluten, but gluten tends to be in a lot of different places that we normally wouldn't see it. A great example is hot dogs. I love that one. And we've got to be very careful. Like, we're not having, if we're celiac, we're not having unintentional gluten exposure. And then ulcers. Ulcers is, again, it's again common with really bad leaky gut syndrome, but we can actually get to the point where we get degradation of the intestinal or soft tissues of the stomach and or intestines, and that obviously becomes a big problem. Now let's look at some less common symptoms that we may not necessarily relate to leaky gut syndrome. The first one I want to look at or discuss is asthma. So with childhood asthma, a lot of times we use traditional medications in the pharmacy world. We'll use steroids, we'll use beta agonists like an albuterol inhaler. And so I encourage you to dig deeper if your child has asthma, to do a food sensitivity or a zonulin test to see if what they're eating might potentially be related back to their asthmatic symptoms. And what kind of dovetails into the next, again, less subtle symptom of leaky gut syndrome is allergies. And I'm talking not about food allergies, but to just seasonal allergies, environmental allergies. So if that is somebody that you know of or that you personally might suffer with seasonal allergies, again, I would encourage you to do a leaky gut test and measuring your zonulin level. Some other less common symptoms associated with leaky gut is weight gain, or even just the inability to lose weight can be a symptom of leaky gut. Mental health issues. So again, we may not necessarily relate depression or anxiety or irritability with our GI tract, but these things have been connected. And so again, if that's you, I encourage you to, again, look at your diet, do a food sensitivity test, do a gut permeability test, just to rule that out. And then lastly, again, where this connection we may not necessarily make, but if you have autoimmune disease, so anything from Hashimoto's or thyroid issues, anything like psoriasis, any autoimmune issue that you can think of that you might be suffering with, I encourage you to work with your provider on looking at gut permeability and, again, seeing if you have that issue. So if you've gone through the test, or if you worked with your provider and have identified that you have leaky gut syndrome, there are some over-the-counter supplements that can be very helpful. And again, as always, before starting any supplementation, I encourage you to talk to your provider, work with a healthcare practitioner that is well trained in these products. We do have 4 pharmacists here on staff now at MD Custom RX. If you need a provider to help work through a protocol for leaky gut syndrome, I encourage you to call the pharmacy. So let's get into the supplements that I would, again, encourage you to look into to see if any of these might be helpful agents for yourself. The first one I like to look at are probiotics. As I discussed just a few minutes ago, if you've got dysbiosis or if you've got bad bacteria in your GI tract, well, let's push those bad bugs out with some good ones. And you might also need a prebiotic as well. So that's something to look at. An easy way to get prebiotics, just as a side note, is to eat a wide range of vegetables. All the different fibers that are found in all of the different fruits and vegetables can be very beneficial to feeding the bacteria. Another supplement that I really enjoy patients taking is l-glutamine. So l-glutamine is an amino acid. I typically talk about l-glutamine in my acid reflux talk. L-glutamine, the way that I think of it is that it's the fuel that those cells on the lining of our intestine use as energy to work, and that l-glutamine basically lays down and repairs that soft tissue, that those cells that are damaged from leaky gut syndrome. One of the last products I would again encourage you to talk to your provider about, or call the pharmacy and have a consult with one of us here, is something called berberine. Berberine has been shown to be helpful in the GI tract, and it also has been helpful in helping to reduce blood sugar in the body. It helps to mobilize fats as fuel, so it helps with burning excess weight in the form of fat stores. And it also can help with improving cholesterol as well. So all of these have been clinically studied, and berberine is a very neat herb that's been helpful over the years for many patients, even outside of leaky gut syndrome. Just a quick recap. If you have symptoms and you're not sure what the cause of those symptoms were, I would encourage you to call the pharmacy or stop in and pick up a gut barrier panel. And again, let's get to the root cause of some of your health issues. That's ultimately what we're trying to do here at MD Custom RX, is to, again, not use medication to cover up symptoms, but rather get to the root cause of problems and get those issues figured out and work with your provider in doing that. Thank you for watching. Again, if you haven't already subscribed, I would encourage you to do that. And if you found value in today's content, I would encourage you to share this with a loved one. In next week's video, we are going to change gears a little bit, and we're going to start talking about skincare, and specifically a new test that we have coming out to help treat acne on an individual per individual basis. Have a great night.